My pleasure to introduce to you our keynote speaker today, Jane Pirkis, the Director of the Centre for Mental Health in the Melbourne School of Population and Global Health, to talk about suicide and the internet. Jane is the Director for the Centre of Mental Health at the University of Melbourne and holds an NHMRC Senior Research Fellowship. She's also the General Secretary of the International Association for Suicide Prevention. Jane has worked in the suicide prevention field for 20 years and is well known for her work on suicide and traditional and newer media. Recently, she's undertaken a number of projects looking at ways of harnessing the media to achieve positive results in suicide prevention. Jane's research achievements have been recognised by a number of awards, including the Commonwealth Fund's 2001 Harkness Fellowship in Healthcare Policy and Suicide Prevention Australia's 2010 Lifetime Research Award. Please join me to welcome Jane Pirkis.
I'm just wondering, do I need to stand by the things? That's right, I can stand here. Sorry, technological. I've got, various things I can do, but technology is not one of them. So thank you all. Welcome everybody. I'm going to talk a little bit about suicide and the internet. And I was thinking about, the title of the talk, and I thought that really if you're going to talk about suicide and the internet, the obvious subtitle, if I could do the thing. Oh, it's not working. I've got a great subtitle. All right, okay. Can you show my subtitle? That's exactly what I want to talk about. I want to talk about some of the good things about the internet and its potential in suicide prevention. I want to talk about some of the potential for harm that the internet might hold, and most importantly, I want to talk about stuff that lies in between and the fact that it's quite complex, really. So the googly. Thanks. So there are quite polarised views, which is kind of what I just alluded to then. So some people are very positive about the internet's potential as a medium for suicide prevention, so that's obviously the good. Some people completely diss the internet and are adamant that it can cause harm and that's all it can do. And their argument is already vulnerable people, particularly, who are searching for information about suicide methods may come to harm via the internet. So that's the bad. But I and others have argued that it's probably much more nuanced than that. And in fact, it's a volatile medium. There's a lot of negative and positive content. So it's a matter of finding your way through it. And that content is available to at-risk individuals, but those individuals are often ambivalent about what they're searching for. So I guess the message that I'll be trying to put forward is that we want to capitalise on the ambivalence, I guess, and make sure that people are directed to good sites, not bad sites. So that's the googly. Thank you. I just also wanted to mention, before I get into the good, the bad and the googly, that national policy documents on suicide prevention from around the world typically make reference to the internet these days, both in terms of its potential use for good and its potential for promoting suicide. And Australia's Life Framework is no exception. So I was looking through the Life Framework documents actually, and it made me realise that the internet moves pretty quickly. So if you look at what the Life Framework main document says, it calls for research into the influence and impact on suicidal behaviours of new technologies or multimedia communication. So, for example, media, internet, MySpace, which I'm not even sure exists anymore, YouTube, chat rooms, instant messaging, which kind of reads to me like it was written a while ago, probably by an adult, not a young person. I think, today people would view what's on the internet a bit differently. Thank you. So let's start by talking about the good. Thanks. So there are loads of suicide prevention apps and websites that exist. They vary in terms of what they provide and how they offer it. So there was a study done by Aguirre, I think you pronounce their name, in 2013. So it was a very simple study. They searched iTunes and the Google Play Store for suicide prevention apps, and they very easily found 27 of them. And now I'm sure there would be more. Some folk led by someone called Recupero in 2008 did a similar study, but they looked for suicide prevention websites. So they inputted various suicide related terms and into a range of search engines. They found 373 unique web pages. They weren't only looking for suicide prevention sites, they were looking to see what would happen if you put in some suicide related terms. But they found that 29% of the sites they came across had a suicide prevention slant, so about a third of them. And Lucy Biddle and some colleagues in the UK did a similar study using a similar strategy, and they did it twice. They did it in 2007 and again in 2016. Each time they returned 480 hits. In 2007, a quarter, 25%, were suicide prevention sites, a bit less in 2014, 17%. So there's a lot of good sites out there, I guess, is the moral of that story. Thanks. I just thought I'd show you a couple of, or three actually, suicide prevention apps that are Australian, or two suicide prevention apps and a website that are Australian. So this is one of three apps that were developed by an independent psychologist in Melbourne. So this one is designed for someone who might be feeling suicidal themselves, but the other two are for people who've been bereaved by suicide and people who might want to assist someone who they're concerned about. So this one is video-based, in fact they're all video-based, designed to be a warm human connection, so that the psychologist herself appears in the video. And it's deliberately designed for people who are probably in quite a distressed state. It's structured and interactive, guides the person through steps designed to pave the way forward in a safer way, such as focusing and planning. It promotes empowerment through self-support, but it also points people to other resources, including local services if they're available. It's free, it's private and discreet, it's widely accessible. It's been described as a self-help intervention in the palm of your hand. And professionals can recommend it as well. It's sometimes being used for clients kind of after hours when the person can't contact the professional. So that's the first one. This is iBobbly. This is also an Australian app that's been developed for Indigenous people, particularly young people, which is designed to be delivered in a culturally relevant way. It's developed by the Black Dog Institute. It's based on psychological therapies that have been shown to reduce suicidal thoughts, so it's quite CBT based really. Draws heavily on Indigenous metaphors, images and stories drawn from local Aboriginal artists and performers, and it's particularly designed to address two major barriers to help seeking. So one is stigma, so if you're looking at this app on your phone, no one else necessarily knows what you're doing, and also geographical isolation, because obviously there are remote places in Australia where there aren't as many services as there are in metropolitan areas. So that's iBobbly. And then Reframe It, which Joe Robertson, who's in the back of the room, was responsible for, is a website, and Joe will correct me if I say anything incorrect about the site, which offers an 8-week online CBT program, which is designed for school students who are experiencing thoughts of suicide. It uses some novel methods to appeal to young people, so it relies on things like video diaries, activities, message boards. The site is practitioner administrated though, so there's a moderator, and it's moderated daily, and personalised feedback is offered on each activity, and there are responses to queries or calls for help that are posted on the message boards. And that is being trialled at the moment, so it's part of a randomised control trial that Joe and Eleanor, who's also in the room, are running. Thanks. So in thinking about suicide prevention websites, we started to think about how to classify them because they as I said at the beginning, they do kind of different things really. So they can sort of be classified, this isn't a perfect taxonomy, but they can sort of be classified in terms of whether they're purely informational and educational, so they just provide static information of some sort, or whether they're interventionist, so that's one spectrum. And then also whether they're passive or they're active or interactive. So so you can work out the quadrants. So the passive ones that provide information and education only are kind of the most basic, I guess. And they just provide information to users. They do it in a didactic way. They often provide resources like fact sheets, and they often point them to potential sources of help. But there's no interaction at all. So that's the first kind. The informative, educational and active interactive sites present users with opportunities to engage in discussion and to network with each other, usually through some sort of forum that might be moderated or might not be moderated. But they're not interventionists, so they don't offer any sort of therapy. They're interactive, but they're not interventionist. And then at the most kind of intensive end, I guess, are ones that are active or interactive and also interventionist. So they're like Reframe It, for example, or like the apps I showed, which present users with strategies for dealing with suicidal thoughts in a structured way. Usually they involve elements of cognitive behavioural therapy or some other recognised form of therapy that's been shown to be useful in suicide prevention. And sometimes, but not always, they have some sort of moderator involved. Thank you. So I've circled the two last ones because they're really the only ones that have been properly evaluated. And in fact, even they haven't been evaluated. There's not a huge body of evaluative evidence yet on these. But I thought I'd tell you what the evaluation evidence does show you about each of them. Thanks. So the active or interactive ones that are informative and educational only, so not interventionist, have been looked at in a number of studies. So I've listed some of the authors of those studies up there. Most of them have focused on forum use. So a lot of those sites involve a forum where people can go on and chat to each other. And the types of studies that have been done have tended to either take the content from the forum and analyse the discussion, look at what happens in the discussion, or have involved interviews or surveys with forum users. So these studies, just to boil them right down and summarise them, suggest that these sorts of forums do allow individuals to make connections with others facing similar situations, which is often a good thing, and that users do find this kind of mutual support useful as a coping mechanism and often as a means of reducing their levels of distress. Users don't always seek advice from others, but the interactions that take place can reinforce positive behaviours. Particularly, it's been shown when members of the online community congratulate each other, for example, for not self-harming and for taking more adaptive courses of action and encourage each other to seek help. So there's obviously some good benefits there. And then the sites and apps that are active/interactive and interventionist are also beginning to show promise as not only effective means of combating suicide, but also efficient or cost-effective because they're relatively cheap. So they, like I said, they often draw on therapeutic approaches like CBT that are well established as effective in the face-to-face realm. But the idea is that delivery via the internet has advantages over delivery in more traditional settings because these sorts of interventions are more accessible and often they're more acceptable as well, particularly to young people. So Brecke van Spijker, who is now in Australia but was in Holland, conducted a randomised controlled trial which looked at a particular website. So it occurred in modules, so people went through particular modules it was unguided, but they sort of followed through the modules. It was CBT based, and it was specifically designed to reduce suicidal thinking. And she found that it was not only effective in doing so, so her participants who were exposed to the intervention had significant reductions in their suicidal thinking, whereas those who, her control group, didn't. So it was not only effective, but it was also cost effective. It was relatively cheap as well. So there are some other trials underway that test different modalities, so apps rather than websites, for example, different types of intervention, so moderated versus unmoderated, and designed for different groups. So, so young people, so Joe's trial is explicitly looking at young people, Indigenous people, so the trial of iBobbly is specifically looking at Indigenous people. So there's quite a lot of work underway at the moment, and the evidence base is building, I think. Thanks. So now let's talk about the bad. So there are, it has to be said, there are pro-suicide websites out there. And various commentators have warned that, you know, the internet's pretty unregulated. So it means that you know, because there are these sites that have not great material on them, there's the potential for them to influence individuals to engage in suicidal behaviour, particularly if they're already vulnerable. So the particular concerns have been expressed about these pro-suicide websites, which usually do two things. So they provide information on how to obtain and or use particular suicide methods. So sometimes, for example, they'll provide information about how to purchase a particular suicide method. And they also promote discussion that encourages suicide. And they're easy to find. So the two studies I talked about by Recupero and Biddle, when they looked for sites, as I said, they found some good sites, but in Recupero's case, 11% of sites were pro-suicide websites, and in Biddle's case, about 9% were. Thanks. So the reason that we worry about these sites is that we know that other forms of media can have a big influence in terms of suicidal acts. So we talk about the Werther effect, which is based on the fact that this novel by Goethe, which was released in 1774, which was about the suicide of the main character, Werther, who you can see there, led to a spate of suicides in Europe once the book was released. And it was fairly obvious that the suicides were related to the influence of the book because people were dressed like Werther, they left notes, or that the book was, in some cases, the book was about their person when they died, and sometimes they used the same method as Werther used as well. So a lot of work has been done, multiple studies around the world, looking at the influence of mostly newspaper and television reports on subsequent suicidal acts, and you know, we've reviewed that body of literature fairly extensively, and it's pretty clear that irresponsible media reporting of suicide can have an influence on suicidal acts by people who are exposed to that information. And it makes sense that pernicious representations of suicide on pro-suicide websites would also have an impact. And in fact, the impact may be worse because of the reach of those sites. So, you know, a local newspaper really doesn't go very far, but the internet is big. Thanks. So a number of studies have been done looking at the association between suicide websites or pro-suicide websites and suicidal behaviour. So some of those, there's a body of studies that are cross-sectional studies. Some of them are ecological, so they've looked at data in aggregate in a particular area at a particular time. So for example, they've looked at the numbers of suicide search terms that have been, or the numbers of times that suicide search terms have been plugged into the internet, and correlated that with suicide rates, and sometimes done it on the basis of looking at a particular suicide method, or sometimes done it looking at suicide in general. But either way, they've generally found there to be a correlation between the two. The difficulty with that is you don't know, so it's possible to establish an association, but you don't know the direction of causality. So it may be that there was an increase in suicide rates, and in fact that prompted people to look at the internet and find out a bit more. Or it may be that people were looking on the internet for information about suicide methods, and that has had an influence on an increase in rates. So this is the problem with cross-sectional studies, that it's not possible to know the direction of causality. So in addition to those ecological studies, there have been some individual level studies as well, mostly that have been done using community-based surveys. And those surveys have asked people about their suicide-related internet use and then their levels of suicidal ideation. And mostly they found that those who engage in suicide-related internet use have higher levels of suicidal ideation. But again, it's not really possible to know the direction of causality. So they might be seeking information because they're feeling particularly suicidal, or it might be the other way around. So that's obviously the limitation of cross-sectional studies. There are some other study designs which have started to sort of drill down into the chronology of events to overcome that problem of not being able to tell anything about the direction of causality. So there are some case studies that have been done linking individuals' suicidal acts to exposure to particular pro-suicide websites. So, for example, one study found that websites giving advice about particular suicide methods were found bookmarked after the death of a particular person by suicide. Other studies have talked to people who present to health services, often emergency departments, in a critical state, having tried to help self-harm, and they have themselves said they searched for information on the internet about how to do it. And there's also evidence of from forum posts of particular websites facilitating suicide pacts. So there's building evidence, but the difficulty with case studies is they're quite small. So, you know, often it's evidence about one person. There's been one study that's a larger scale audit, which David Gunnell in the UK did, which was a review of inquest reports from 12 British coronial jurisdictions over a 3-year period. So he and his team burrowed into the coronial reports, or the inquest reports, looking for definitive evidence of internet involvement. And they found they could find definitive evidence in 1.5% of the suicides, which sounds small, and you wouldn't expect it to be huge. You know, obviously it's not going to be an influence in all cases, but that is probably an underestimate because they relied on it being noted in the inquest report. So obviously there will be cases in which no one knew. Thanks. So in addition to those other studies, there has been a particular focus on forums and the influence of forums. So these forums that get used for sort of pro-suicide purposes, and they have received quite a bit of attention in the literature. As with the positive forums, or positive activity on forums, most of these studies have looked at either interviewed or surveyed forum users, or they've looked at their posts. And they've collectively identified a number of undesirable outcomes, such as individuals being encouraged to view suicide as normal or acceptable as a course of action, people being actively advised to hide their suicidal thoughts and intentions from others rather than seek help, people being guided towards using particular suicide methods, and people being invited to form suicide pacts, as I said. So there's obviously some not great activity happening out there. Thanks. But I want to talk about the googling. So this is a cricketer whose name is, and I'm not going to be able to pronounce his name, so I apologise if there are any avid cricket fans in the room, but his name's Bernard Bosanquet, and he invented the googly. Thanks. So Wikipedia, which is my great source of all my research knowledge, describes the googly as a delivery which appears to be a leg break, but after pitching, the ball turns in the opposite direction to that which is expected, behaving as an off break instead. Right, so I fell asleep reading that, didn't really understand it, but what it means is that the delivery has unexpected results. And I think the same is true in the context of suicide and the internet. The picture's not as straightforward as it initially seems. So it's just not as black and white as the good and the bad. Thanks. So one of the reasons it's not as black and white is that identifying and finding suicidal content online is murky. For a start, there's an argument that classifying whole sites as suicide prevention sites or pro-suicide sites misses some of the complexity of the online, what's out there online. So my very clever PhD student, Catherine Mock, who's about to submit her thesis, used a similar method to the study I talked about that Lucy Biddle did in the UK, where she surveyed, where she used search terms to identify suicide-related websites, but she used a more nuanced classification system. So she didn't classify a whole site, she classified the content of sites. So some of them were suicide prevention sites, some of them were pro-suicide sites, but there were a lot that were mixed kind of sites. So she found that her findings were complex and the sites themselves were complex, particularly for sites that had forums. So many sites provided information on suicide methods and acted as a springboard for discussion about particular methods among users, some of which was positive. So, for example, there was a lot of conversation which steered individuals away from using a particular method, and some of it wasn't. So some of it suggested methods that might be more likely than others to be fatal. So there was good and bad on the same site, in the same forum, on the same page. She also found that explicit encouragement of suicide on these forum sites was rare, and there were a lot of comments that were often quite supportive and life-affirming, but there were also instances where there was a lot of dismissive language used or even hostile responses being posted. So again, very mixed sort of language and sentiment. This is probably a bit impossible to see, but I wanted to put it up because this is a study that was done by Kemp and Collins, who are from New Zealand, with some kind of geeky computer types who knew all about the workings of the internet. So what this shows is they looked at how individual sites were networked with other sites by looking at the activity between sites, so they could map that. And what you can see is that there are some very big dots and some very small dots. And the big dots are sites that a lot of other sites direct traffic to, and the small dots are sites that not much traffic is directed to. And the big dots are suicide prevention sites. So the bottom line from their study was that although there are a mix of sites out there, the much better connected sites are the positive sites, the suicide prevention sites. So I think that's kind of interesting because if you can, it just means that the likelihood of people finding good sites is much better than the likelihood of finding dodgy sites. Thanks. So just a little bit more about online searching for information about suicide. So the other thing to say is that individuals who search for information about suicide do traverse a number of websites. So people don't generally just go to one website. They go, they trawl around a bit and see what they can find. Keith Harris from the University of Newcastle did an online survey of suicidal individuals who used the internet for suicide-related purposes. So very specific. He had people who had recently experienced suicidal thinking and they explicitly used the internet for suicidal purposes. And he found they typically visited both suicide prevention sites and pro-suicide sites. There's a suggestion that this maybe reflects some of the ambivalence that is often associated with suicidal acts, suicidal thinking and suicidal acts, which has been described elsewhere in the literature. It may not explain the whole thing, but people do have a certain ambivalence quite often, I think. Thanks. So the other thing to say is that the impacts of exposure to online information are very complex. So people respond to the same piece of information in different ways. So again, Catherine Mock did a survey that was a little bit similar to the one Keith Harris did, but had some nuanced differences. So she surveyed 102 Australian young people, aged between 18 and 24, who said they'd gone online for suicide-related reasons in the last 12 months. And she asked them about what their experiences were, and in particular, the impact of that kind of material online had for them. So she said, she found that overall their online experiences were associated with a decrease in suicidal thoughts, so that's a good thing, and also behaviours. But the orientation of the websites they visited had no bearing on this. So overall they got better, but it didn't really make very much difference whether they were going to good sites or bad sites. Ultimately, they went to a mix of them, and their impact was generally good. However, they described positive and negative experiences even for similar forms of internet use. So, for example, some found that reading detailed information about its particular suicide method deterred them from using it, whereas others found doing this gave them the confidence that if they were going to use that method, it would be fatal. So people had different experiences, and there were different impacts for different people. So I think this has some implications for practice, which I just wanted to talk about. So, and it's mostly the complexity, the googly, that has the implications, I think. So there are various ways of promoting good and minimising harm that have been suggested, but they all require a bit of thought because of this complexity. So the importance of suicide prevention organisations getting their own content right online, and educating internet users. So I'm going to talk about each of those in turn. So guidelines for creators of web content. We've done quite a lot of work on guidelines for journalists on responsible reporting of suicide in traditional media. And people often say, well, can't you just kind of modify them a bit for creators of online content? And there have been some guidelines developed. So there's a picture here of guidelines that have been developed for social media content by the Entertainment Industries Council in the US. And I would say there's certainly a role for these guidelines, but the difficulty is they're unlikely to be viewed by the majority of average viewers who are people, people who are going online, taking part in discussion forums. They're not going to see these guidelines. And worse, they're likely to be actively ignored by those who deliberately post pro-suicide content online with malicious intent. So while I think these sorts of guidelines are a good idea, I think their reach and impact is ultimately going to be limited. Thanks. Legislation is another interesting one. So I have a picture of a judge here who was plucking, as you do, I was plucking images from the internet myself yesterday, and I looked at this morning and thought this judge would have never gone anywhere near the internet. So the proposal has been put that it might be possible to legislate to ban pro-suicide material in an online environment. Most countries have regarded it as too difficult, usually because they've said, well, the internet transcends international borders, you just couldn't do it. Australia actually is unique in having introduced legislation of this kind, which it did some time ago, and this legislation makes it a punishable offence to disseminate material designed to counsel or incite suicide. When the legislation was introduced, it did appear to lead to the removal of entire websites that would have been regarded as pro-suicide. However, Catherine Mock's recent study has shown that there's still potentially harmful material being posted online that's readily accessible to Australians, often in the context of mixed discussion on forums. So it's, perhaps it's possible to ban a site that is wholly and solely pro-suicide site, but it's very difficult to monitor content that's embedded within broader sites. Search engine optimisation strategies have also been proposed. They're used all over the place in other contexts. They're designed to increase the chances that someone searching for suicidal information online will provide preventive or supportive information, so the good information, rather than pro-suicide material. And given some of the studies that I've talked about, there might be some mileage in this. So, as I said, Kemp and Collings found that sites with a preventive orientation are well linked, whereas the less positive sites are poorly linked. And also this thing about ambivalence. So people who seek suicide-related information online often traverse a number of good and bad sites, and even with both across sites and within sites. But it will be imperfect because positive and negative information is simultaneously available on the same site. So it is difficult to know which sites to optimise for that reason. Suicide prevention organisations. So obviously suicide prevention organisations have a responsibility for ensuring that their own online activities have the desired effect, particularly given what I've said about what intuitively you might think to be the desired effect might actually not be what's happening. But there are some really good examples of suicide prevention organisations using the internet to positive effect. So, for example, some have developed quite high profiles on social media and have used that presence to be able to put in place rapid response strategies when someone is online and looks like they might be at imminent risk. But there are also examples of paradoxical effects. So Smithson set up a forum which admittedly wasn't part of a suicide prevention organisation. It was basically done in the context of some research, but it was a forum in which self-harming young people could communicate with their peers and also a range of health professionals, so it was linked. But when they looked at the online interactions, a lot of them were really not great online interactions, so they normalised suicide and they treated it as a routine and acceptable response to stressful life events. So again, it's tricky. So the final strategy is about educating internet users. So all of the other strategies I've mentioned are about improving the content of what's online. This strategy comes at the problem from the other end and is about equipping internet users, and particularly young people, to make sure that they're savvy users of the internet and engage in internet use in a safe way. So there are no published studies in this area as yet. Again, Jo Robinson, who's here, is conducting a small study that involves two components. So I'm sure she will tell you more about it, especially if you have another networking activity. So the two components are providing education to participants about safe and potentially unsafe ways of talking about suicide online. So this is for young people and recognising that they might be discussing things on forums or in other online environments. And it's also, the second component of the project is working in direct partnership with participants to develop some safe and acceptable suicide prevention messages that can be delivered in a more generalised way via social media platforms. So, as Jo herself would say, the project's still in its infancy, but there's some early evaluation data that indicates that it's having positive effects in terms of making people feeling better able to talk safely about suicide, and also to help online and to help other people do the same, which again is important in that kind of interactive forum environment. Thanks. So I'm nearly done. I just have a few conclusions which kind of bring together everything that I was trying to say, hopefully. So the first thing to say is the internet is obviously far-reaching and very influential, and the information on it changes rapidly. It's a very volatile medium. People who go online looking for suicide information or suicide-related information may interpret the information in different ways and also may be influenced by it in different ways. And this will depend on a range of factors, including their own current mood state. So, you know, something they skip over at one point, they may absolutely focus on at another point. And I think the complexity is amplified by the fact that suicidal users of the internet content are also the creators of it. So, like I said before, that I can get my head around how you can develop guidelines that might be useful for journalists, because journalists are generally the creators of information in traditional media. But the whole game changes on the internet. It's the users and creators are one and the same. But my main conclusion is, the main thing I'd like to say is that the suicide prevention sector and the online media sector really need to work together to maximise the preventive capacity of the internet and minimise any harms that it can cause. It's very fine line. That's it. Thank you.
Thank you very much, Jane. I think you delivered a very insightful presentation and certainly highlighted the complexity of the information available on the internet. We'd like to open up now for questions for Jane. And we've got a couple of mics that will go around the room just to... We've got a question over here.
Jodie Tenho from Monash Health. I just wanted to ask, was there any differentiation in the studies between pro-suicide sites and pro-euthanasia sites?
That's an interesting question. No, not that I've seen.
So are they treated as the same thing? Or?
Yes, it's an interesting question. I think they were, and generally, but I think the tricky thing is with pro-euthanasia sites, people who wouldn't typically be the target of those pro-euthanasia sites get caught up in them. So particularly, for example, pro-euthanasia sites that promote particular suicide methods, that information becomes available to not only the people who, you know, for example, terminally ill older people who those euthanasia sites would target, but young people looking for information online. But it is a good question.
Any other questions?
I was going to ask, not that it's probably being studied, but I wonder whether youth using the internet are slightly more savvy because they have had access to it for sort of life.
Yeah.
Whereas older people, perhaps, when they're searching, maybe not as savvy and are finding things, or whether they would just sort of read the first thing that they came across.
Yeah.
I suspect that the youth, even though they are naive and youthful, can potentially find their way around the internet a bit faster.
Yeah, I'm sure that there's work being done showing that young people are better at using the internet, full stop, than older people. Keith Harris's work was interesting because he, before he did his searching, he did a small study before that looking at the kind of search terms that young people would use compared to, or at least that suicidal young people would use compared to researchers. So it's a slightly different question, but he found they use completely different search terms. So he then used their terms rather than his terms.
Yeah, right.
And Jane, I was interested that the content that people are looking at, whether it's pro-suicide or suicide prevention sites, really didn't matter, but there was a dissipation in suicidal intent at the time.
I should say that not for everybody. So, but on average, there seemed to be a kind of cathartic effect, a reduction in suicidal thinking, and there didn't seem to be any differentiation in terms of the sites that people had been to. But there clearly were some individuals who had increases in their suicidal thinking who had been to some not great sites.
Yeah. So is that sort of a really a therapeutic effect happening, or is it sort of just suicidal intent dissipating over time?
Well, again, it's difficult to say. Yeah, and you know, Catherine's study was great, but it's a relatively small sample of internet use, people who go online for suicidal reasons. I saw Susan there with the microphone.
Hi Jane, thanks for that. I had a question about contact, so exposure to people who have had a lived experience. We know research says that it reduces stigma and all of the positive flow-on effects from that. So my question is, do we have any research that looks at contact that is introduced via the internet? So seeing people's stories and lived experience, does it have the same effect as a face-to-face exposure to somebody's story in terms of reducing stigma, increasing help seeking?
Yeah, I haven't seen any studies that specifically do that, but it is fair to say that some of the apps and some of the websites that have been developed for suicide prevention purposes incorporate perspectives of people with lived experience, as someone who features in the intervention, and also the positive impacts of the forums. That probably lies in some ways behind some of those positive impacts, because those forum users are connecting with other people who are in a similar situation to themselves when there are positive impacts.
Amanda Lee from Near My National. One of the earlier slides actually included self-harm. I'm wondering whether the studies actually differentiated between suicidality and self-harm for us, given that self-harm can actually be a protective factor and prevent people from actually suicidality. Where was that?
Some did and some didn't, but I think mostly they get lumped together. And sorry, just one more thing to say about that. And I think a lot of users wouldn't differentiate.
Yeah, I just wanted to ask about, you're talking a lot about people doing Google searches, but I have a teenager and she spends most of her life on Tumblr, Snapchat. I wondered if any of those sites were reviewed.
So in Catherine Mock's study, when she looked at the sites that came up as the most common sites, when she plugged in various suicide-related search terms, those were the kinds of sites that came up actually. Not all of them, but a good majority of them were general sites where there was a lot of suicide-related discussion happening.
One question over here, please.
Hi there. I was wondering if Catherine's study has revealed any differences between how men and women use the search engines. Is there any gender difference?
She didn't really have the numbers to look, I don't think, and I'm not sure whether Keith Harris did either, but that's a good question as well. Come and do a PhD with us.
So, are there any other questions in the room?
Hi Jane, what are some implications for organisations in the suicide prevention sector around your research? How could they best use it in terms of moving forward and navigating through this?
Well, I think it's like I was saying towards the end. I think a lot of suicide prevention organisations would have websites. In fact, probably most do, which has obviously various content on it that has a particular intent. And I think it's about, wherever possible, just checking that the desired influence is actually what's happening. Because, as I said, people interpret information in different ways.
I think it's quite interesting with the SEO, trying to get that search engine optimisation for people that do have suicide prevention websites. It's sort of making them responsible for making sure that their content is well linked.
Yeah, that's right, yeah.
Because most people are likely to search on that first page or click on that first page of Google.
Yeah, that's right. People don't go much further, yeah.
Yeah, so I could see that as being a really effective way.
And there are examples where organisations have done that. So there's an organisation called SAVE in the US that's done work in that area.
Yeah, so they're doing it for organisations or something?
Yeah, well, I think they're sort of exploring the potential of it, basically.
Great.
I just had a sort of quick comment. With in one of your points, you raised, the moderation of websites. You can look through whole websites which are dedicated to pro-suicide, but not the actual content. There's also, I think, a responsibility of the search engine companies to omit or include particular bits of information, which I think sometimes doesn't also get acknowledged as easily. That there's in finding those websites, the conduit is the search engine websites. So particular governments working with those companies to make sure that the right search terms are generating the right type of outcomes, and the ones that aren't favourable are being omitted or not as easily found.
Yeah, yeah.
Hi, I'm Sue Sandy. I'm from Neurobalance. I have a question for you. Just do you see the research behind the information that's being gathered in the research being used to develop content for education, particularly in the primary sector, because a lot of the primary school students now are using technology. And working in a school part-time as a primary school welfare officer, I'm conscious of the fact that there are a lot of really great education programs around bullying, and there's a particular program called the Respect Ambassador program, which is about people who are bystanders and asking them now to intervene and to act. And I can see that that this would formulate really great content to educate primary school students on intervening when they're aware of the fact that someone that one of their friends, for instance, may actually be on the pathway of harm. And let's look at it realistically. A lot more younger people these days are actually completing or attempting suicide.
Yeah. So there are certainly school-based programs. It's probably fair to say the majority of them are more targeting high school students. And there are, but again, I guess it's that thing it's that tricky thing about being really careful about the information that's being put out there and how it's being interpreted, and monitoring it and evaluating it very closely along the way.
Are there any further questions? Okay, well, I think that wraps up